My name is Sandra Valtero, and I'm your host. I'm here representing Be Prepared, which is going to be a new show for the Burlington Volunteer Reserve Corps. Today we're having a special program to dedicate this show, well, I shouldn't say the show, to celebrate the Burlington Health Fair, which is going to be on May 7th on a Saturday from 10 to 1 p.m. And today I have some guests who are going to talk about the health fair and how it got started. First of all, to my left, I'd like to present Susan Lumenello, who is the Director of Public Health here in Burlington. And she's also our unit director for the Burlington Volunteer Reserve Corps. And next to her is Roberta Gullage, who is the public health nurse, and she was also involved in getting all the preparations ready for the health fair. And next to her is Michelle Synder, who is the Community Relations Manager at Lahey Hospital. And they are sponsoring this health fair for Burlington. So let's talk about that, ladies. How did y'all get started? You want to say something about that, how you got involved with doing the sponsoring for this health fair?
Yeah, absolutely. Susan let us know that the health fair was going to be going on again last year, and it's something that's so in line with our priorities as an organization, spreading information about health and wellness out to the community. So of course it was something that we wanted to jump on board with and be sponsors of, and we're happy to do it again this year.
Right, great. This is the second year.
Second year.
Right,
Yep.
okay. So a lot of work involved, right?
Yeah, we're really excited about this year's health fair. We have over 40 vendors coming. It's going to be at the Burlington High School gymnasium. So last year we had it at the Memorial School, so we're expecting more vendors and more people this year, so we decided to make it a little bit bigger.
You're going to need the room, that many vendors,
Yes.
yeah. And Roberta, you did a lot of work getting in touch with a lot of the vendors.
Yes, we actually have an intern, and she's helped out greatly. We took the vendors that we had last year, and we also added more, so that worked out very well.
Great, great. So we can expect seeing a lot of the same people from last year as well as some new people
New
this
people,
year.
exactly. More assessments, and yeah.
Great.
The Burlington Volunteer Reserve Corps will be having 3 tables at the health fair. So they're going to be doing a hands-only CPR demonstration. They will have a recruitment table, and they'll also have a table where they'll be doing blood pressure screenings.
Great. Sounds very good. It's family friendly, right? You're going to have some things for the children also? Like last year, I think you had a few kinds of things that kids could get involved in.
Yes, we're trying to gear it towards all ages. So we have things for seniors and things for younger people. So we're trying to have it as an event for the whole family.
Great, great. Well, we had a chance to interview a few of our vendors. So I'm going to show one clip here, and then we can talk about it. Okay. Let's take a look at Rita Shah, who is a licensed social worker who works with Lahey. Could we see that clip, please? Hi, Rita. My name is Sandra Valtero from the Burlington Volunteer Reserve Corps. Could you tell us a little bit about yourself?
Hi, Sandra. My name is Rita Shah. I'm a licensed clinical social worker. I'm a graduate of Burlington High School, and I've been in Burlington on and off for 34 years. I love Burlington, and my work with Saheli is very, very important to me. Saheli is a www.saheliboston.org is a South Asian domestic violence agency that serves the South Asian survivors who have been abused by their family or spouse or partner, and we help them get shelter, legal and immigration help. We help them with counseling. We help them with furniture. We help them get some clothing, whatever they need to start their new life. We can help them. We help them understand all their options. Just to tell you a small story, yesterday we got a call from a Muslim survivor who was bleeding, and the police and DCF was involved. And she still, after all that, wanted to go back to her husband's home because her culture and her religion and all that. And we helped her understand her options and helped her understand. And then DCF would not give her child back if she does decide to go back. So it was really, really complex issue where we work with DCF for DCF to understand that what the culture is and how the reason what she's saying. And then when they took her daughter away, she's told DCF that I'm going to kill myself. So that really made DCF more worried that she's not stable. But this is kind of, she did talked about it, but she was not going to do it. She said, I just said it because I thought they would not take my daughter. So there's a whole cultural understanding is needed for all of the providers to know that South Asian culture is different. And when there is a survivor of South Asian, we want to make sure that they do reach out to Saheli. This service is 100% confidential, is totally free. So please reach out. And you are not the only one. 1 in 4 women in Massachusetts do get domestic abuse sometime in their lifetime, and 1 in 3 South Asian women are sexually or domestic violence abuse in their lifetime. So it is a really critical for the woman to know that they are not the only one. There's many women out there, and we do offer free support group in our office that they can come and join anytime.
Okay, how I know that a lot of women feel afraid to reach out, that their spouse or partner is going to find out that they're doing that. And so how can they reach you in a safe way?
So we do have a free phone that we can give it to them. So if they do come to our office, we will be happy to give them a free phone that has 3,000 minutes that they can use it. And every 6 months that get replenished for another 3,000 minutes that they can use it to call out to their family members, to us, or anybody. So that is something available. We can give them a free whatever services, then we can help them learn the technology, what to do after they use a computer to reach out for help, and how to wipe out all the history. So we can teach them about that. So there is a ways they can make sure that they can get help, but at the same time they can clear their marks, so that way their abuser don't find out what is going on.
Yeah, sure, that's very scary. So at the health fair, what will you be presenting? How is your thing going to be set up for everyone?
So we are going to be sharing some of the survivor stories. We have a storybook that we're going to be doing. We have a couple of videos that we're going to be sharing. And then we're going to be just talking to people, answering questions that they might have about how, if they do know of somebody in their family, friends, or community might need help. So we can just tell them what are the resources that we can help with them.
Yeah, I can imagine it may be friends and family members and not necessarily the person that's being abused.
Yeah, exactly.
Exactly. And do you do private counseling with them also?
Yes, we do. I'm a licensed clinical social worker. So in our office in Burlington Center, we do offer a couples counseling, we offer a family counseling, and we offer individual counseling. So if you are interested in any of those counseling, please reach out to us, and we'll be happy to provide that free of charge.
Oh, that's great. Free of charge.
Yeah.
And so do you have brochures and stuff you'll be handing out?
Yes, we will have a brochures and a business cards that we'll be handing out that people can easily grab and give it to their friends who might need it someday.
Absolutely. Great. Well, thank you so much, Rita, for sharing all that with us, and we look forward to seeing you at the fair.
Thank you, Sandra, for giving me a chance to talk about Saheli, and I'll see you at the fair.
All right. Michelle, I'm a patient at Lahey Hospital, and they always ask that question, do you feel safe at home? Do you have any involvement with Saheli or any of the organizations concerning abuse?
Absolutely. Domestic violence and raising education awareness is a huge priority for us at Lahey Hospital and Medical Center. One of the things that we do through our social work department is coordinate the domestic violence initiative. So this is a group that brings together different social service agencies from all over town, and we're able to coordinate our response and education efforts around domestic violence in the town of Burlington and our other surrounding communities. It brings together groups like Saheli, like Reach Beyond Domestic Violence, the Public Health Department, the Council on Aging, the Police Department, and our different departments in the hospital, just to make everybody on the same page around this very important issue.
It is very important. I'm glad to hear that you guys are all involved with that.
Absolutely. And at the health fair, we're actually, one of our offerings is going to be information from our social work department about domestic violence and about some of the other things that we're able to offer for free at the hospital in our support groups.
Great.
Yeah.
Good. I had no idea. That's wonderful.
Thank you.
Thank you. Okay. Let's take a look at our second clip, which is PT. It's Pat Agostino. He's from People Fit. Could we see that clip, please? Hi, I'm here with Pat today from People Fit. Pat, tell us a little bit about yourself and People Fit.
So my name is Pat Agostino. I'm a physical therapist. I'm one of the owners of People Fit Health and Fitness Center here in Woburn, as well as People Fit at Home, where we send physical therapists into people's homes to exercise with them safely.
That's great. So, Pat, I understand that exercise is really important to avoid cardiovascular problems
Yep.
or diabetes
Yep.
even. Could you tell us about that? What would you do for people like that?
So first off, we want to figure out if they are at risk for developing diabetes, cardiovascular problems. And a lot of times what your doctor may use is BMI, or body mass index, which is a quick and easy way for you to figure out if you are at high risk for developing those things, as well as high blood pressure and high cholesterol. What we have found is that people who even don't score maybe in the obese category, who might be just slightly overweight but have a large waist circumference, that those people are also at high risk for developing type 2 diabetes as well as cardiovascular disease.
And what would be considered high waist?
So if you have a large waist circumference, that's typically 35 inches or more for a woman and 40 inches or more for a man.
Wow, okay. And how much exercise would someone have to do in order to help them?
So that's the magic question. And a lot of times they say about 150 minutes per week tends to be enough exercise or a good starting point to reduce your risk of having heart attack, stroke, and actually about 4 or 5 different types of cancer.
Wow, even cancer.
Yeah. So cancer and other things. And a lot of times what they recommend is things like cardiovascular disease, which we think of as walking, jogging, bicycling. And then if we can add 2 to 3 days per week of progressive strength training exercises where we do large muscle lifting exercises, and it doesn't have to be with heavy weight to start with, those things really tend to add muscle to your body. And adding muscle will reduce your risk for heart attack, stroke, and type 2 diabetes because muscle is a great filter for blood sugar.
Okay, say someone had an accident and they had to be, sedentary for quite a long time, and now they have to get back to exercising. What do they do?
Yeah, so we try to avoid that altogether. And you hit the nail on the head. One of the things that makes People Fit special is that we can help people to exercise despite having a health issue. Just because you have knee arthritis, or just because you have a diagnosis like Parkinson's disease or a stroke, doesn't mean that you shouldn't be able to get regular forms of exercise, and we help to put that program together for you.
That's great. So you're going to be at the health fair in May, and what will you be presenting there?
So we're looking forward to the health fair in May, and there we'll be talking a little bit more in depth about what type of exercise is appropriate for you despite having a health issue.
And how will you do that? How will you?
So we'll have someone manning our booth and discussing those things, as well as we're going to have a body fat composition scale, which is a great way for us to figure out what you're made up of, fat versus muscle. So if you're brave and you want to come down to our booth, we'd be happy to test you.
Great. I don't know if everybody want to get on the scale, though.
I'm sure we'll be there just to answer questions, so feel free to walk up. I promise I will not put you on the scale.
Thank you, Pat. All right, well, then we'll see you at the fair.
Great. We look forward to it. Thank you.
Bye-bye. Good interview. Anyways, physical therapy. Well, I've had my experience with physical therapy myself. Roberta, what would you like as a nurse to say about that?
Well, I echo everything Pat has said. I think exercise is very important to reduce your cholesterol, for your heart, decreasing, your chances of, getting diabetes. I look forward to seeing him at the health fair and getting on the scale and seeing where my body fat percentage is.
Oh, true. Brave soul. I don't know how many other people do. You want to do that, Susan? Yes. I don't know, right?
But I was very interested in his numbers about women with being over 35 inches and men over 40 inches for their waist circumference. And the BMI is very important.
Oh, definitely.
Yes.
Yeah. I know that organization, they also go out to the homes of people like after surgeries and so forth. So they do that also, which is great. You know, we need that. In fact, I had that after surgery. So anyways, let's get to our next clip. And let's see, the next clip is from High Point Chiropractic. Dr. Candace Mutter is going to tell us about herself and the company there. Hi, Candace.
Hi.
I'm here at High Point Chiropractic with Dr. Mutter. You want to tell us a little bit about yourself?
Sure, yeah. My name's Dr. Candace Mutter, and myself and my husband, Dr. Andrew Mutter, own High Point Chiropractic. We're located at 83 Cambridge Street, right across from Landana, and we've been here for about 6 years. And we're a family wellness center, so we see infants, children, also adolescents, adults, and senior citizens, and we provide chiropractic care and family wellness.
Great. So how important is having an adjustment for everyone?
Well, we feel it's really important from the earliest moments of life. A lot of folks don't realize that the birth process can be very traumatic and can influence the spine of little ones. We see a lot of infants coming in who have difficulty breastfeeding, maybe experiencing colic, and have, torticollis, which is an issue with the neck. Chiropractic care can help that and we provide gentle adjustments to the neck to help, restore normal range of motion to the neck.
Wow. Are parents worried that it's going to be painful for their children?
Well, sometimes they have that concern when they come in, but we reassure them that we use very gentle pressure. In fact, I often use the analogy of testing a tomato for its ripeness. You would use that similar pressure when adjusting a child.
Do you use any equipment in order to adjust?
Yeah, sometimes we do. We have an activator instrument, which is just a gentle impulse that we can use into the spine. We also use our table that has drops in it. But again, it's a very non-invasive, gentle way to adjust the spine. We do use our hands too, but all of the care here is tailored towards the individual needs. And we assess that at the time of the visit.
So the person can say for themselves what they would prefer you doing.
Well, we absolutely take their comfort level into account. If someone feels uncomfortable with manual adjustments, we can achieve the same effect by using an instrument. So that's absolutely high on our priority list.
Okay, great.
Yeah.
So what are you going to be doing at the fair for us?
Well, I'm going to be providing digital spinal screenings. So I'll be bringing my iPad with me, and I have this really great application that digitizes posture. So people will come to the table, they'll stand a distance away from me, and I'll take a picture of them from the side. Then I'll bring the person over, and I'll show them the different points that healthcare providers use to evaluate posture. After we do that, their values will come up against what has been established in the literature for healthy normal. So it's a really great tool to teach people about their posture and also their health, because we as chiropractors say posture is a window to health. And a lot of people will look at these results and say, oh my goodness, look how far my neck is out of alignment, or my pelvis. Do you think that could have something to do with my headaches or my shoulder pain or my back pain? Sometimes it does, sometimes it doesn't, but the important point is it opens a conversation. And people will then, talk to me about different things, and we can see if chiropractic is a good fit for them in their health care.
Well, that sounds like a lot of information that we all need.
Yeah.
So we'll look forward to having you at our fair in May. So we'll look forward to seeing what kinds of things you can suggest that we can all stand up straighter, right?
Yeah, sounds good. I'm looking forward to it. Thank you for having me.
Thank you. Wow. It's a lot of information that we can really use, I think. And please, all ladies, sit up straight. We don't want to get a curvature or anything, right? So what would you like to say about this, Susan? Any comments?
So that's one of the great screenings that we have going to be having at the health fair. We're going to be having the blood pressure screenings and the BMI screenings. And another thing I wanted to mention was that there's going to be a lot of free raffles. So a lot of vendors are going to be bringing raffle items, and each visitor is going to have 25 tickets, free tickets, to come and put in their raffle choices. So they're going to be giving away gift cards and monthly memberships to yoga and health clubs. And so it's going to be a lot of good things there.
Great. Any more vendors that are going to be dealing with the body and, like a chiropractor or another PT person? Is it pretty spread out so everyone is unique in itself?
Yes, we're also going to be having demonstrations, fitness demonstrations. So we're going to have Tai Chi demonstration and Zumba, and I think there's going to be a yoga
And karate.
and karate. Yeah. So we're going to have a demonstration area set off from the tables. So if anybody wants to come and try out an exercise class for a half an hour, they're welcome to do that as well. And the schedule will be on the Board of Health website.
Mm-hmm. Great, great. Do we have any chiropractors at the Lahey Hospital or anything like that?
So we're actually going to be coming out to the health fair, and one of the other things that we're going to be offering is a posture screening through our physical therapy department. Our physical therapists and occupational therapists are amazing, and they're thrilled to be able to participate in the health fair this year.
Great,
Yeah.
great.
Well, one of the other things we're going to be having is a cooking demonstration. So Wegmans is going to be coming and doing a cooking demonstration as well.
Do you know what they're cooking?
Do we know? I don't think we know.
No.
Yeah.
I'm sure it'll be good. I'm sure it'll be good. At least it'll be healthy, right, Wegmans? I hope so.
Oh, yes. Yeah.
Okay. Any other food situations there? I mean,
That will be the only food that's going to be given out. So we're not going to, no one else will be giving out any food just as part of that demonstration.
okay.
So, no. But there will be other, there'll be yoga tables and there'll be, what is more?
We also have the Burlington High School Medical Club that are coming, that we just added on. We have recycling, gentleman coming to talk about recycling, his table. We have the skin cancer screening, somebody coming from there, poison control.
Wow. Wow. The skin, are they going to do something about screening people's skin?
I'm not sure
or-
what they're going to be doing. They're probably just going to maybe assess your skin, but they are melanoma.
Yeah, so they'll be doing some sun damage, so for your face, so facial
Ah.
sun damage screening.
Yeah.
Oh, good, good. Now that the kids from the high school have a medical, tell me about
They
that.
they have a medical career club.
Oh.
I think it's ages 14 on, and so yeah, they'll be coming and telling us all about it.
What do they do? I mean, do they put on programs
No,
on
they-
educational medical situations?
No, as far they're very new to me. I'm actually going out next week and chatting with them. So they don't go out into the community. They stay in and they get speakers that come in and they learn what other health professions are doing. And it's based on what I believe what they want to do when they grow up, what careers they want to have.
Sounds like we have a really nice program going on. And you'll have some things for the children that they can do with their families, any kind of games going on?
No, mostly just the fitness demonstrations. Yeah, no actual games. Last year we did have an obstacle course, but we won't be having that again this year because it's just not enough room in the area we're going to be having it. So we had to.
Good, good.
Yeah.
Sounds really good. Well, this show here was made up special just so that we could advertise the May Fair. So please keep that date in mind. It's May 7th from 10 o'clock to 1 o'clock. And Be Prepared is going to be a new show starting in June. And our shows are going to be centered around health, wellness, and education and safety. So we hope that starting in June you will join us. And everybody, please get out to the fair. I'm sure there's a lot of interesting things that we can learn about just by going and listening to some of these vendors and what they have to show us. So thank you very much for joining us tonight. We really appreciate you coming. And I'd like to thank my guests, Susan, Roberta, Michelle. Thank you so much for being here. And that's it for Be Prepared.